Long-term care pharmacy is really unique because we don't just stop at filling the prescription. We take it all the way to the bedside. We want to make sure that the residents are getting the safest medications at the best times and making sure that it's done in a safe way.
The resident population is very vulnerable. They are needing medications very timely, and it's really easy when you're integrated with the electronic health record. You need that information instantly, and you want to make sure you have all the information on the resident. So we have a team in the e-pharmacy department that monitors the health of the integration to make sure that that works as expected.
Our customer base is so diverse. So we have our independents, our assisted living, and then we have our more complex residents who are in our skilled nursing homes. So 24 hours a day, 7 days a week, whenever our facilities call, somebody's here to answer. I guess going into every call, there's a chance that it's an emergency, because even though we're getting 700 calls a day, that's a small percentage of the number of scripts that we're sending out. But the one thing that keeps us going is remembering that person, about that grandma or father. We just couldn't do what we do with the number of calls that come in unless we have that connection and we keep it at the front of our mind.
If you think about dispensing almost 3,700 prescriptions on a daily basis, you need to make sure you have a lot of safeguards in place to make sure that they are accurate and timely. If you look on our shelves, we're really a combination of a retail pharmacy and an institutional hospital pharmacy. We have to have what they need when they need it. It's really important that we have appropriate inventory in our pharmacy. Once the order comes in, and our order management technicians will process the prescription, they will enter it into our pharmacy system. So at our packaging step, they actually scan the barcode, and then they scan the drug to make sure that they match. And through every step after that, its barcode is followed through there. When the medication has been actually dispensed, it then goes into our clinical review with our pharmacists. They're actually checking it again. If you think about up to 11 medications per resident, it takes a significant amount of time to be able to cross-check and make sure that there's no interactions. There's also the barcode checking and making sure that, again, it's the right drug, it's the right quantity, and that it is in a compliance packaging so that the facility staff have an ability to make sure it's the right drug.
We not only have to take care of dispensing the medication, but we really need to get the medication from our door to the patient. So we have to track all of our deliveries, and so we have to work within the regulations of our state, within the regulations of the DEA, because we're responsible until it gets there. We deliver in the rain and the snow. If there was a tornado in Oregon, you name it, we would do it. I've worked overnight and have had calls at 3:30 in the morning for an IV that was newly started because this patient has pneumonia. They want to start it within the next hour, otherwise they're sending them to the hospital. That can cost that patient thousands of dollars if they just walk through that door. But because I'm here, I'm able to stop that. So our clean room is where we do all of our IV mixing, compounding. It's a service that separates what we do from any retail setting. We have the ability to create time-sensitive, high-risk medications and get them to the bedside.
The pharmacy is really, really quick at responding to our needs. We're lucky enough with the long-term care pharmacy to have 2 consultants. We have a nurse consultant and a pharmacy consultant.
My pharmacist team takes a hands-on approach with residents, being in the facilities, working with the interdisciplinary team, such as the nurses and the prescribers, so we can make recommendations that are most appropriate for them, which is very different than a retail model.
Our whole purpose is to be able to stand in the gap for those people that have nobody to advocate for them. We know that it could be our family members, so you take each one of those personally.
The goal is to thrive, prevent rehospitalizations, and we'll just make the patient's quality of life better. And I think the long-term care pharmacy is really helping with that. We couldn't do it without them.
We don't just fill prescriptions, we're so much more.